Hi, I'm Dr. Devani Amaratunga, board certified gynecologist and fertility specialist. I'm going to talk a little bit about pain management in gynecological procedures, in particular IUD insertions. Now, there's been a fair bit of media around this lately, with women posting on social media platforms about some quite distressing and painful experiences they've had, particularly in IUD insertions. So let's have a look at IUD insertions. There are different reasons why we might insert one of these. One is for contraceptive purposes. Two is to prevent heavy bleeding. Three, maybe to help with pain. Now, when we insert an IUD, it needs to be inserted through the internal os of the cervix. Sometimes this can be quite painful for women who, for instance, has underlying pathology such as endometriosis or pelvic pain, or has had a bad experience in the past, or simply because they haven't given birth previously and so that cervix hasn't dilated before. You can insert an IUD under very many different circumstances. One is in theatre. This could be specifically to insert the IUD or as part of another procedure, for example, if you had a laparoscopy. Two is in the rooms in your clinic. Now, the type of anaesthetic or analgesia that you use in your room does depend on what is available at the clinic and can vary from local anaesthetic infiltration, so just a little bit of anaesthetic inserted with a needle next to the cervix. That can take a couple of minutes to take effect. Or there are other options such as gas, the nitrous gas, or even the green whistle, Penthrox, you may have heard of this. Now, choosing how we insert the IUD is extremely important, and it's essential that we individualise this. Past experiences, pain levels, pathology, whether they've had children before, age, all of these factors come into consideration. Ultimately, you want to feel comfortable as a patient going into one of these procedures, that your doctor will listen to you and that there are options for you. As a doctor, we need to be comfortable to change our minds during a procedure. For instance, if a patient isn't coping or it's more painful than what we initially thought. We need to have tools to be able to change and offer our patients. And it's really important as a patient that you seek a clinic or a doctor that has those tools available to you. Gynecological procedures can be uncomfortable but shouldn't be painful, and all options should be available to patients so we can individualize them and choose what is right for them.